all the healthcare warriors, a big thank you, a pillar of strength like a tree cashew. Your work dynasty saving life fearlessly. I dedicated this line to all the dignitaries present among us. I, Faizan Sayed, the host for the evening, feel very pleasure to welcome you all to the prestigious webinar. This webinar is designed to enhance and appreciate some wonderful personalities in the field of healthcare. Gautam Buddha has said, to keep the body in good health is a duty. Otherwise, we shall not be able to keep our mind strong and clear. You all are the one who regulate his job of maintaining proper health among us. We all know the world is suffering from very tough days, and you all are the everyday putting efforts, determination, and courage to eradicate the current pandemic. Not only you, but your family members stood towards you like pillars. Hence, we are the Golden Aim Awards organized by Dinergic Business Solutions, honoring you for the contribution in the field of healthcare. Once again, welcome you all to the most prestigious webinar. Moving further, now I call upon Dr. Fareen Khan, co-founder and CFO of Golden Aim Awards, chairperson Asia GCC Conclave, and chief editor of Great Brand Magazine, to speak few words. Over to you, ma'am.
Thank you, Professor Sayed. Good afternoon and welcome you all to the Golden Aim Conference and Award for Excellence and Leadership in Healthcare. This is Dr. Fareen Khan, co-founder and CFO, Golden Aim and chairperson Asia GCC Awards. I would like to thank to all the participants, speakers, and other guests for gracing this occasion. The objective of the award is to recognize and felicitate healthcare professionals who have demonstrated outstanding contribution in their respective field across Asia. Healthcare professionals are considered to be one of the most important parts of the society. And the medical profession is considered to be one of the noblest professions. The medical profession has evolved over the centuries and it's still evolving. Medicines and treatment from various diseases and illness that are not available earlier now have been developed. Medical technology that has enhanced over the time. If we have good doctors and medical facilities in our vicinity, it offers a sense of relief. As we know, we have instant helping hand. Doctors are considered to be next only to God. This is the day to acknowledge, recognize, salute, and pay tribute to the selfless and unconditional service that has been rendered by the medical fraternity, particularly the frontline healthcare workers, who have placed their life to risk to save several people out there. This is the perfect day for the doctors stand a community together to rebuild the lost trust and ensure we continue to save life. Your contribution and the hard work deserve our gratitude each and every day. And today I'm very pleased to connect with the best of the best professional experts. Each award winner will be felicitated by a trophy and a wooden citation as a memento. Moving further, I request Professor Sayed to continue with the webinar ceremony.
Thank you so much, ma'am, for such a wholehearted welcome. Now, I call upon Mr. Azharuddin Farooqi, co-founder and CEO of Dinergic Business Solutions and Managing Director, Pharma Global Management Services, to speak few words. Over to you, sir.
Good afternoon to everyone. I, Azharuddin Farooqi, CEO and co-founder of Dinergic Business Solutions. It is both an honor and privilege to stand before you and welcome you all to this prestigious webinar, Golden Aim Conference and Awards. I express my gratitude to all the professionals present in today's webinar, and I'd like to thank all the physicians, healthcare professionals for your hard work, thoughtfulness, and commitment during this challenging time as they put their life on risk to serve the patients. And my company, Dinergic Business Solutions, we provide solutions in various segments and sectors such as garment, real estate, healthcare, and fitness chain. We started our business in 2010 with a small warehouse in Mumbai, and with the support, we built our chain national to international level. Nationally, we have chain in Mumbai, Pune, Delhi, Bengaluru, and internationally, Dubai, Oman, and Indonesia. And with the team support, hope to build more chain in future. And I thank the Golden Name team to give a chance to be a partner in today's prestigious webinar, where healthcare professionals and thought leaders share their views and knowledge. Thank you so much, and over to you, Professor.
Thank you so much, sir. Now we move on to our conference ceremony, and I call upon our first respected speaker, Professor Dr. Ramesh Gilimaga, Head Regulatory Affairs Emeritus Professor in Radiation Oncology, President of Indian Society of Oncology, and sir's topic is digital transformation in healthcare, how it has impacted our current oncology practice in India. Over to you, sir.
Okay. Good afternoon, Professor Saidi, and my greetings to Dr. Farina Khan and Muhammad Nazaruddin Faruqi from Golden Aim Conference. My talk today is going to be on the digital transformation of healthcare, how it has impacted our current oncological practice in India. I'm the president of Indian Society of Oncology. So greetings from India. And the working as a professor emeritus in the HCG group of hospitals and based in Bangalore. I started my oncology journey in 1975 and started with Cobalt and the radiotherapy machines. And you can see all these machines are the kind of analog the time that I started my career. The X-ray machine, the mammography, and how radiotherapists, we used to treat the breast cancer patients. And that most important point I want to say in the left-hand corner is the contact with the patient was so cordial and nice, and the digital world has really changed this. And the grouping of the surgeons, and you can see it very clear. Then, and from that day onwards, and we have seen sea of change that has occurred over a period of time, from a 2D to 3D era, and from there to 4D, and we have already gone in. The instruments have changed from analog to the digital, be it a thermometer or any other measuring equipments, and we have today the artificial intelligence added to that, and with the help of the cloud computing, and we have a virtual reality in our medical space. I take one good example, and which is which I can showcase is the breast cancer scenario when digital science is being applied very logistically. It has a risk stratification and a screening and a treatment options and a response assessment and prognosis and outcome. So in all this field, the digital transformation has really impacted us, our practice. The first to start with the breast cancer screening and the tool that we use, a mammogram. And if you really see that the analog picture, you can see one side, and the digital image, you can see how clearly one can visualize that. And going further from here, and the AI has come into the picture, and it is really outperforming the human, even the reading of the analog picture that we had. So is the case in even in other fields too. There are two types of studies that we can really see here. The one is a breast cancer risk assessment tool, and the breast cancer and ovarian analysis of the disease incidence and career estimation algorithm. These are the analog days, and from there, and we moved on to the machine learning tools, and we have taken, and there are two methods that we use generally, either adaptive boosting or the random forest, and both have given 88.89 and another one 88.828. And whereas the earlier analog one used to be 62.4% and was 1. So therefore, there is a good amount of accuracy and which has really helped us as the days gone by. Then comes the issue of genomics. And from the usual reading of X-ray plates and the radiomics can extract and mine a large number of medical imaging features and in a non-invasive and cost-effective way. And the underlying assumption in radiomics is that the image features that is quantified here is represents the phenotypic characteristic and in the entire tumor. And one such a study that we have done as a pilot study in head and neck cancer in our hospital is taking a 44 and a PET CT scan and extracting a 79 radiomic features, and the predicting the recurrence chances is almost to the extent of a 93% sensitivity and with a specificity of 86%. All this is possible because of the digital transformation that we have. Then, and coming from the X-rays or imaging sciences to, we were going to the digital pathology. Earlier on the left-hand side, you can see, and our pathology used to be hooked onto the microscope, and from there, and we can see with the computer, and our pathologist is seeing and the best possible and pictures that she has. Just to give it two such example, and at the left-hand side, so the computer is being programmed now to read the normal tissue, and the right-hand one to identify the diseased portion of it. And I can show you one more picture also, which is the automated identification of the colorectal tumor, and from H&E tissue sample, and using a deep learning model, and which shows very clearly the heat map, and also how do we extract this area can also be seen very clearly. And this is a tissue mark 1 model. And this is about the pathology, and of course, going further is the digital transformation and the treatment decision that that we can take is in the case how do you really go further is 1,000 case was analyzed, and here we have used Watson oncology, and here the MDT and versus MDT it was compared. And in all cancers combined together, the 4 cancers were compared, and the one was a rectal cancer gave a concordance of 93% and with the MDT, and a breast cancer it was 92, and lung cancer it was 89, and colorectal was 81%. So the conclusion of the author in this study was the study suggested that the cognitive computing decision supporting the system and holds a substantial promise to reduce the cognitive burden on the oncologist by providing the expert and updated recent evidence-based insight in the treatment and related decisions. This will be very, very useful, and in a 2-tier and a 3-tier studies, where you can't get highly expertised the oncologists in those areas. And in another case of the concordance that you can see, how do you risk stratify, and depending upon that, and can we give a chemotherapy or a hormone therapy in a breast cancer can be decided. And one in the tumor, to the left extreme one is a tumor board decisions, and the endopredict and assay, and the third one is a Watson. Both Watson and endopredict have really concurred 100%, and the tumor board has to change its decision and in this regard. So in other words, it helps the medical oncologist to choose whether to give a chemotherapy or to go ahead with the hormone treatment for that patient. Going further, and how do we really, which one know to choose, whether we should use a chemotherapy and radiation, and even in chemotherapy, what type of the chemotherapeutic agent that we should use, because there are a number of the chemotherapeutic drugs are available in the market. And for this particular patient, if you really categorize that, and it is possible to say in this particular study, it says the dose-dense ACE regimen is better in this case, and that should be followed by radiation. This is how Watson oncology guided the doctors, and how you can really address the patients in a right way. Going further, The data that we really collect and is either from the health records or pathology images or genomic data or even the drug therapeutics, and they're all inbuilt into the embedded data, which gives a right result. And this knowledge predicts the clinical phenotypes. And when that is done, and which shows which are the drugs that we can select and for this action, and shows the selection and optimal therapy and for this particular patient, which is good. So this is how the precision medicine is now coming to use and using AI-based precision medicine. Next, the sequence that's coming is a sequencing 500 gene panel, and at one point of time, and when the gene atlas was sequenced, and it took almost 13 years to do that, and with a huge lot of money was spent. And today, the NGS can do that in 24 hours and gives a right signal, and for which patient this molecular the methodology or a genomic based the therapy can be addressed. And this is again possible because of digitalization we have today. And passing and from that to the electronic health record. This is not very specific to oncology alone, and this is in general. All these specialization can use this, starting from a radiology, hospital, and the patient portal, and wearable devices. So in all spheres, and these health records comes into picture, which helps for data analytics, treatment outcomes, and follow-up of the patient, and for the research and personalized patient care. The electronic health record is a very handy tool today. The pandemic of 2 years has really boosted the use of telemedicine, and that it is today it's all pervasive, and be it a telepharmacy and telenursing and digital survivorship card and virtual clinics, and quite a lot of time. And we do the counseling of the patient or treatment advice and through the teleconsultation itself. Remote monitoring is also possible, and the AI and machine learning has really added a good amount of accuracy in doing all the telemedicine field. And this has paved way and for our virtual tumor board. In our healthcare system, and we have 22 medical centers spread all over the India, different parts, and tier 2 and tier 3 cities. And we do a tumor board. We do that. So the multidisciplinary approach is possible, and because of this virtual tumor board. If you really see the evolution of radiation therapy, starting from 1951, date, when we have mRNA and then adaptive radiation, and we all progressed, and because there's a lot of the technology improvement and use of digital science has involved in this. I can give you one very nice example of that. If we don't really embrace what happens to the machinery or the science today. Right example is if you see this bar diagram. At one point of time, there's about 20 years back, or 20 years back, it was 50 linear accelerators we had, and in India, and cobalt was 258. But as in today, if you see in 2022, and we have a cobalt 175, and whereas linear accelerator is 492. That only shows because the linear accelerator really got digitized, and a lot of technology got into in the picture, the era of the linear had picked up so well. So unless we embrace the change that's occurring around us in the technology, and we will be lagged behind. It's a very good example of such technology changes. How did that help us? And if you see in the 2D era, and we used to do the mark on the patients like this, and in the extreme left, and then in the 3D era, and we have just moved one step further, and with the technological improvement, and now today we have intensity modulated radiotherapy to treat the cancer of the patient. One such example is the breast cancer. And going further is even when we treat these patients with radiation, and the tumor regresses quite drastically. And when it does, and over a period of time, and even we can even change the radiation field as the treatment progresses. So that is possible, called as the adaptive radiotherapy by use of artificial intelligence is order of the day. Again, that is because of the digitization that we have today. And from there, and if you move further, and we have the digital therapeutics, and that is is encompasses the whole lot of IT industry, healthcare providers, and patients, NGOs, and a regulatory body, and the pharmaceutical industry. A huge lot of a digital acumen you can see here. And this has transformed the collective data into the actionable insight, and with the objective to bring the value to the evidence-based clinical outcome. And in the in medical oncology, both in chemotherapy and in the supportive oncology care, and is very, very useful. And the coming to the surgeon, so how do they use this? And today, the augmented reality is a boon to the surgeon, and a surgeon can determine the best point of entry, and with by minimizing their recovery time and optimizing the outcome of the patient, and while maintaining the sterility in the field. So now, it guides surgeon and how best he can enter into the tumor and where it is located, and with the least complications. The next step that takes is the robotic surgery, and which is becoming very popular these days, and because it has a lesser, fewer complications such as a surgical site infections, less pain, and less blood loss, and a short hospital stay, and a quicker recovery. Smaller and less noticeable scars. And you can see, and now the surgeon is operating in the control console, whereas the only one person is here in the operation table. To that extent, the crowding is totally avoided. Yet, and the surgeon has a full control of the robotic arms and from his chair itself. And the next point that I can see for the surgeon in the future is actually the tele-robotic surgery, that is sitting from one place and he can operate in the different place altogether. That is helpful because of HoloLens, be it at Google or even Microsoft have come out with HoloLenses, and with that, and one can guide even the person who is operating distantly, and how and you can help him even the two surgeons in at different remote places. And in fact, in our hospital, we conducted it from Bangalore to Mysore, the surgical operations using HoloLens. So that is where I know we are really progressing, and in a digital world. And all that is possible, luckily, with the government of India. So, the encouragement, and in fact, they have started the registering all government hospital, medical facilities and doctors and the Ayushman Bharat digital healthcare mission. And in fact, now a person, even in sitting in the northeast, and even if it comes to south, I can carry the digital card, or you can automatically get transmitted so long as you have got that code and with him. So the world has really shrunk. It doesn't matter how far you are staying, how distributed you are. The digital world has really changed the way that we practice the oncology today. And lastly, and my journey, and now is in 2022, I can see the from the cobalt era, and we are progressed into the cyber which we use in our hospital, and digital pathology, and surgeon is seeing, and the Da Vinci and a robotic surgeon, and a digital mammogram, and a big data collection, and we have a data knowledge, in an action plan that can be carried out. All this is today how from analog stage, and we have transformed to digital, and from digital we are going further, and with the availability of the 5G in India, maybe we'll be still progressing and further. Thank you very much, and for giving me an opportunity to share my thoughts. And all that I can say is change has really revolutionized the way that oncology sees the patients today. Thank you.
Thank you so much, doctor.
Thank you so much, Doctor, for sharing your kind support with the organization. And we are presenting a thank you memento on behalf of Golden Aim.
Well, thank you so much. Very nicely done.
Thank you, Doctor.
Now we move on to our next respected speaker, Dr. Balkrishna Shetty, President-elect of Indian Radiological and Imaging Association, Karnataka. And sir's topic is Advanced Integrated Healthcare. Over to you, sir.
So I would like to speak about advanced imaging. I heard Dr. Pelimoga speaking about radiotherapy and management of cancers. Now, before management of cancers, we would like to know the imaging of various diseases. So how we image the various diseases, whether it is cancer or inflammation or infection or anything, we need to know, what is a diagnosis. First of all, is it a cancer or is it a benign lesion? Number one. Number two, if it is a benign lesion, if it is a cancerous lesion, what is the stage of the cancerous lesions? Most of the times we classify these cancerous lesions into 1, 2, 3, 4 stage. And if it is, and what is the level of advancement? For this, definitely we would like to show I'd like to have the imaging. So let me tell you, the management includes, one is the clinical diagnosis, second is a laboratory test, and the fourth is imaging tests. The imaging investigations means basically it means that is it is identification of a lesion, that is evidence-based medicine. Now I'll give you some small examples here. Now this patient who had a small swelling on the right side of the neck, and he was operated, telling that it was very good lesion, and they said they removed the lesion, and this patient had a scar because when they started operating, they could not remove the tumor completely. So whatever the tumor they could remove, they removed, and they just wanted to know the extent of the tumor. And so this patient had a scar here, and he came back for a imaging. This is what is called the CT scanning. And you can see that this is a tumor of the parotid gland, which is going inside, and what is called as a deeper extensions. So when we see a patient, we may superficially, there is something, but it may have deeper extensions, which may not be seen very well clinically by examination, what is called as inspection, palpation, percussion, and all those things. So we need to have a cross-sectional imaging. I'll show you one more patient here. This is a 45-year-old man who had a chest X-ray, and there was a large tumor in the lungs. And they operated this. They thought, okay, this is no, this can be operated. They operated, but within 4 or 5 days, the patient came with history of multiple convulsions. He had a lot of problems. So then they did a CT scan of the brain or the MRI of the brain, which showed multiple metastases. What I mean to say that if there may be a tumor in particular part of the body, but it are extended to other parts of the body, which need to be seen before doing heroic surgery. So before doing the surgery, we would like to know the extent of the tumor, and also we would like to know whether it has spread to different parts of the body. Now, the brain metastasis. So similarly, we have got, whenever we get a bone tumor, we can get a small lesions in the lungs. Even though we do a lot of surgeries for these bone tumors, you may have this particular, what is called as a metastasis or the malignant lesion, which has spread to the rest of the lungs, brain, kidney, liver, and heroic surgeries may not be required when the malignancy or the cancer has spread to different parts of the body. So now I'll show you some other images, like this patient who had who was bleeding. He had hematuria, like when he was passing urine, he could see the blood. So if there is a blood in the urine, the blood might have come from the kidneys, it would have come from this collecting system, or it could have come from the urinary bladder, just like you see in the anatomy picture. So we need to know there is blood in the urine, but we need to know where is the blood exactly coming from. So we need to do this particular study, what is the study of the kidney, ureter, bladder. And this lady comes with a huge abdomen, You can see this is the MRI, which shows a large, this is a solid tumor, this is a cystic tumor, this could be a malignant tumor, or this could be a cystic tumor, which cannot be differentiated by just looking at this particular image or by examining this particular lady. So we need to know whether this tumor is very dangerous or this is a tumor like a cyst which can be managed without much complications. So here I talk about the evidence-based medicine or advanced medicine for management. So what I would like to say, it is not open and see, it is a see and open. So there are various tests for that, like X-ray, ultrasound, CT scan, MRI, nuclear medicine. These are all the list of scans. Yesterday, one patient was asking me, sir, should I get a scan? Then I said, okay, you could get an MRI. I said, should I get a scan as well as MRI? Should I get an X-ray as well as MRI? So there are so many confusions about the scan. Scanning is just like you are seeing the internal structures of the body, for which you can use X-ray, ultrasound, CT, MRI. So these are the most important investigations. Now, how these investigations are done, what is the importance of each and every investigation, so you'd like to know. So what are the basic principles? Like in chest X-ray or in the X-ray, you see mainly the bone, what is called the radiographic density. You can see the bones, and in a chest X-ray, you can nicely see the lungs because it is containing air and it has got very, very less density, so it will appear black. So I would like to say, because all these images are black and white in color, so we don't have colored images. We have only black and white or a gray shade. So in the X-ray, the air will look black, the bones will look white. So it is basically depending on the X-ray density. Now, similarly, in CT scan, the technique or the physical principles are the same as X-ray because it uses an X-ray scan. Only thing is it gives us the cross-sectional imaging. So you can do the cross-sectional imaging. You can take sections at 10 millimeters, 5 millimeters, 1 millimeters. So all those things are possible. Basically, you cut open the body without actually cutting the body. So you cut the body into multiple 1 millimeter slices or 5 millimeter slices or 10 millimeter sizes and see the internal parts of the body. That is a CT scan. So basically it is a computerized axial tomography. Let us not go into the details of that. We also got what is called a panoramic view, that is usually used for evaluation of the dental. How to cut the body, because I don't want to go into the details of these particular physical parts of this imaging, but basically there is one X-ray tube which goes around and the patient goes inside. As the patient goes inside, the computers will give you axial sections. This is the internal part of the CT scan. Now, in the CT scan, you also get all these black and white images. The white images are due to bones and the black images are due to fluid. And basically, it is decided by what is called as a Hounsfield unit, like the zero density is for the water. And if there is a higher density, then you get infected fluid, soft tissues, white matter, gray matter, like that. So as the density increases, the lesion will appear more whiter, and as the density decreases, the lesion will appear more black. So now let us say this is a CT scan of the patient. Now there's 3 patients with accident. So the patient had an accident. So that is white. That means there is blood, and there is another white. There is also blood. So all their patients came with the history of injury. All the patients had clinical symptoms, neurological symptoms. So these 3 patients have got different pictures on CT scan. This patient has also got hemorrhage. This patient doesn't have hemorrhage, but diffuse edema. This patient also has got hemorrhage. So what is a management? So management for all these 3 patients will differ as far as the CT findings are considered, not as far as the clinical findings are considered here. Now this patient has what is called as a blood collection outside the brain. It is called extradural hemorrhage. So that has to be evacuated immediately. This patient just wants to have a proper guidance and management and observation. And this patient has got blood inside the brain parenchyma, which also needs to be observed. So the management of all critical observation may be required here because there is a bleeding within the brain. So the clinical setup may be the same, but these findings on CT scan will decide what is the management for the particular patient. Now, similarly, these two patients, both the patients fell in the bathroom and they were unconscious. And look at this particular brain and look at the brain, this brain. This brain, as I told you, there is a hemorrhage, and this brain, there is a black density here. So this black density means there is an infarction. Infarction means there is a decreased blood supply, whereas in this particular patient has got a bleeding. So this patient has got increased blood, that means bleeding. This person has got blocked blood circulation, that means it's an infarct. So the management for this blocked circulation or increased circulation and hemorrhage will be totally different. So now coming to the MRI. MRI basically shows a fluid. Now look at this. This is MRI of the spine, which shows the bones, and the white thing is a fluid, and in between you can see the neurological structures. So MRI is a beautiful imaging for the diagnosis of spinal cases. So we can do coronal sections. We can do various other. Now this patient actually came with the history of with the right hip pain. Okay, now when we do MRI here, we don't see much problem in the hip joint. This patient, this is the urinary bladder. So when we do another sequence, which is called fat suppression sequence, you can see a lot of inflammatory fluid in the right hip joint. So in MRI, the advantage is not a density. The MRI will tell us the images because we acquire the images as by the physical principles of the blood and water. So that's the beauty of MR imaging. So here also you can see the beautifully the urinary tract without giving any contrast. That is the beauty of MR. Similarly, you can do MRI for the breast. You can do MRI for various parts of the human body and find out whether it is a malignant or not. So how do we assess whether the particular lesion is malignant or not? By giving an injection. And what we do is also called what is a diffusion study. The diffusion study says what is the density of the cells. So if there is more density of the cells, it means it is a cancerous cell. If it is less density, means it is a non-cancerous cell. So that is how we can differentiate the various swellings in the human body. So you can do the whole body MRI and find out where all it has spread. So this is the beauty of MR imaging. So we also do what is called the spectroscopy. Spectroscopy means in a small tissues, it will find out the metabolites within the small tissues. So there are various metabolites in the various tissues. So we can find out whether it is a normal metabolite of the tissues or it is an abnormal metabolite. Abnormal metabolites will be seen in cancer. Abnormal metabolites will be seen in infection. Abnormal metabolites can be seen in trauma. So we can identify these various metabolites by doing this spectroscopy. So we have got various metabolic indicators which will tell us whether it is whether it's malignant or not. But the most important thing is increase in the size of the tissue is the most important parameter for defining whether it is benign or malignant. It is called the doubling time. That is also very important. Now, another thing which we can do is what is guided procedures. We can put a needle in a particular lesion without opening the human body. It is called CT or ultrasound guided imaging or ultrasound FNAC or a biopsy. So this will help us in identifying the various tissues of the human body. So if you do a biopsy, there are chances that you may be disseminating the disease, if it is infection, if it is cancer. So we would like to do the imaging, and with the imaging, we would like to know whether it is a benign or a malignant lesion. So these are all various imaging protocols, which I don't want to go into detail because of the shortage of time. This is what is called the 3D imaging, advanced 3D imaging, which is useful for dental implants. And finally, this is all the images which are useful for identifying various diseases of the human body. So with these things, this is what is called a 3D coronary angio to look for coronary artery disease without doing a catheterization. So these are all the advanced, this is a colonoscopy without putting a tube inside the colon. This is what is called axonography. You can see each and every nerve structure of the human body. And these are all the advanced images which I thought I'll share with you. And I thank you very much for giving me an opportunity to talk to all of you. Thank you very much.
Thank you so much, Doctor.
Thank you so much, Doctor, for sharing the kind support with the organization. I request the team to share a thank you memento on behalf of Golden Aim.
Thank you so much, Doctor.
Thank you.
Moving further, I call upon our third respected speaker, Dr. Ramyajit Lahiri, consultant and in charge emergency medicine, President Society for Emergency Medicine India, West Bengal chapter. And first topic is ED health quest, safety and ED. Over to you, sir.
Good afternoon, everyone. I'm Dr. Ramojit Lahiri. So today I'll be talking on health quest. Well, this is a little different actually than most of our eminent speaker have talked. I'm talking about our doctors who have talked about the disease. The previous speaker sir was talking about imaging modalities and all. So this is something we are going to talk about. Is it is an issue what we have seen on behalf of society, that during 2009 actually MCI first given clearance for emergency medicine as a specialty. So after that, what we have seen, since 2015-16, even though there are numerous hospitals available in India, but there were the emergency department was not being developed that in a that pace, or it was not being paid adequate attention to the department. If you look into the 2017-18 data, it was showing almost 28,000. We have government hospital across India, but the unofficial study what a society we have done, we have seen that not even 10% is equipped with a proper emergency department. Now, if you see the 2019 data, the number of private and public hospital in India has increased a lot. It is almost 69,000 total. But still, the number of emergency departments throughout India, or the adequate manpower, or doctors managing emergency department is inadequate. And this is not only our society is talking. If you look into the recent Niti Aayog report, the recent report on emergency and injury care in district hospital, if you look into the report, you will see that only 3 to 5% of the total hospital bed consists of an emergency department, and there are numerous deficiencies like absence of point of care, absence of demarcated triage area, there is no police control rooms, there is no separate access for ambulance, the adequate spacing in emergency department was absent, and the most important part, that the ED was manned by junior doctor rather than the specialist. Well, this is, don't think this is only the picture in the district hospital. The tertiary level center in India is also equally bad. The overall deficiency is almost same, and one good thing is only that the private hospital ranks little better than the government hospital as per the standard metrics of assessment. So in 2017, what society have done? Society, we have tried to collaborate with ISRO. Well, it all started in 2017 when we met ISRO scientists. And you might be thinking, okay, why we are talking with ISRO and what is the importance? Because worldwide ISRO has proved that they are capable providing adequate and providing a quality outcome. So what we have done is we have associated with them, we have taken their knowledge so that the healthcare service can get enriched from their knowledge, because their funda was very simple. You pay adequate attention to the quality of your design, you pay adequate attention to the quality and conformance, hence automatically your performance will increase. And as I was telling, ISRO is very well known throughout the world that they are capable of handling all uncertainties. Well, emergency department is also like that. Emergency department here, it is very uncertain because all the patients are in a very bad state and you don't know the outcome. So what you can do is you can just give your best and right time and with quality care so that you can expect a better outcome. So what we did is we tried to acquire their knowledge and we tried to develop simple. We tried to do a structuring of a proper ED, which is simple, which is relevant and can be adaptable in every places, and it should not take too much of resources, and over time you can measure that all this with a good outcome. And the object, the thought of behind it is so that with those emergency department we can provide the essential emergency care which our population actually demands. So that was our main objective. So what we did is we started this program called Health Quest. We designed the ED. Well, in my right screen, you can see that this is two type of ED we have designed, where there are double entry or a single entry, but entry and exit are in different places. Here we have talked about everything. We have talked about designing of the proper ED with a proper ED nurse who will be doing the triaging once the patient is coming to the triage area, who will be actually a proper qualified nurse with a ACLS, BLS trained, then a doctor who is an emergency physician who is trained in emergency medicine, will be evaluating the patient in priority 1, 2, 3, 4 beds, and according to the patient's demand, he will either resuscitate or give the adequate care to the patient. And if a patient requires admission, he will plan for admission, or a patient requires discharge, he will discharge. So all this, a quality design with a quality manpower. Next, what we have done is we have introduced a quality champion in it. The quality champion is forming a quality department in the ED, so that the work done in ED is monitored and we can actually assess the quality of service providing to the patients. And those quality team will be properly trained by CAHO or AHPI, so that they get the adequate knowledge of quality in healthcare. Then what we have done is that the area, the pattern of patients movement throughout that area, then the spacing of beds between different areas. So area, how much area you need for a triage, how much area you need for those priority areas, how much area you require in resuscitation, how much area you need as an ED, OPD, everything has been designed and everything has been determined. Then what we have done is we have made a list of equipments which are very much essential in managing this critical patients. Now, what we've done is we have made a book that is called Health Quest, where we have talked about everything. We have talked about the triads, the initial assessment, the protocol, transfer criteria, everything, so that once somebody is planning to start an ED department, they don't have to go anywhere else. They can just take it from that book and they can start implementing it. Now, if you look into this triage, everything is given. The patient waiting area, the triage area, resuscitation area, everything has been demarcated, everything has been given, along with the space requirement of each and every place, and the qualification of doctors, qualification of nurse, qualification of the technician, which is required to manage the ED department in a proper way. Now, the initial assessment is a very important part while assessing the patient. So we have designed an initial assessment for doctors. We have initial assessment design, for adult as well as pediatric. We have done an initial assessment design for nurse, so that the assessment is proper and the care of the patient becomes proper. Next, what we have done is we have developed multiple protocols, like thrombolysis protocol, or a poison protocol, or a snake bite protocol, say MI protocol, STEMI protocol is called. So if somebody is having a heart attack or someone is having a stroke, so how to go ahead with it, so that everybody can understand how we should act on those patients and how we can reduce the damage, and simultaneously providing the adequate and proper care to the patient. Now, that quality team, what we were talking, they will evaluate the performance of door to triage time, the door to doctor time, the door to needle time in case of thrombolysis. Then if somebody presented with a severe pain, then how much that pain we have taken care, whether that pain has come down or not, or investigation return time, a nurse patient ratio. Then all these feedbacks and all these audits, check audits, all this will help them to improve the quality of care in the emergency department. Then one of the most important part, that is the communication part. So this communication, we have made a communication sheet. So in every step, there is a communication done. Like, patient came. So pre-resuscitation briefing to patient or patient attendant. Once we have done the resuscitation, the post-resuscitation briefing to patient or attendant. Then briefing them whether, what is my next plan. I have resuscitated that patient. Then whether the patient is stable or very sick or critical, giving them an exact picture where actually their relative or their loved one is, at what stage actually their loved one. So all this, what we have done is to increase the quality of the department. And at the very end, there is patient satisfaction survey. So in that, the patient satisfaction and the satisfaction of coming to emergency department, their cleanliness, from their waiting room staff, notice your arrival, everything has been mentioned in a checklist. So accordingly, you can identify, and if you follow them, then slowly you can improve your quality of care. So that was our main agenda while making this Health Quest book, and this we published in 2017 first time along with ISRO, and the pilot study done in Dr. Mehta's hospital, and the pilot study there have shown that by monitoring these basic things and by ensuring all those basic steps, we can definitely improve the quality of care in emergency department. Well, this was only a single center study that we have done. Now we are doing a multi-center study, and it's been going on in around 10, 12 hospitals across India. And very recently, we have just finished accumulating those data, and we are in process of evaluating those data. And in near future, we will be revealing those data, and we are hopeful with the knowledge we have acquired from ISRO and the protocol that ISRO HPI have made with this Health Quest, it is going to improve the quality care provided in the emergency department. Thank you.
Thank you so much, Doctor.
Thank you so much, Doctor, for sharing your kind support with the organization. And we are presenting a thank you memento on behalf of Golden Aim.
Thank you.
Now we move on to a much awaited award ceremony. And our first category for the award ceremony is Innovative Healthcare and Life Sciences Entrepreneur Award. And the award goes to Dr. Rao Teki, founder and CEO, Bell Health. Congratulations, Doctor. Can we have a few words from you, sir?
Yeah, thank you for the Golden Aim Awards team for recognizing and giving this award on behalf of the Golden Aim Awards. I've been hearing the conversation with the other doctors presenting. The digital health is coming actually a very significant impact into the life sciences as well as healthcare. I will talk more about the healthcare itself right now. So what I wanted I've been bringing around 35 years of international experience, started my career in 1986 as an orthopedic surgeon and practiced orthopedic surgery for about 10, 11 years in Saudi Arabia. During that period, I was a treating physician for Royal Family of Saudi Arabia and also participated in 1990 Gulf War. Been in US for last 21 years, involved in healthcare transformations and healthcare agility within the US and other global locations, and also been part of a transformation initiative in the life sciences customers. That's last 20 years I've been doing it. With all these 30 years of experience within the life sciences and healthcare, I felt with the COVID scenario, there's a lot of need for a transformation or a digitization opportunity within India. Yeah, a digitization opportunity within India because of the COVID. So I thought that giving back to our country is a need of ours. So I came up with a lightweight mobile application, primarily addressing two components. One, how we can help the connectivity between the patients and then the patient relatives. Primarily, relatives were not being allowed to see the patients because of the COVID. So this mobile application can actually measure real-time vital signs of the patients, and they can see on their mobile phone as and when it comes into scenario, right? It's a real-time scenario. The second thing is when the patients are being discharged from the hospital, there is a loss of connectivity between the healthcare provider as well as the patient. So this mobile application actually helps in connecting the patients who are being discharged with the doctor on a continuous basis. So they don't have to come to the hospital on a periodic basis because of the COVID situation, but the doctors will be able to get to know the actual scenario, what's happening. So that's the one mobile application I brought in. And also this application, what I would say is it helps in the connectivity within rural population as well as the more developed tier 1 cities, because the connectivity between the tier 1 city doctors with the rural patients is missing out. So this application helps in. So these are all some of the healthcare initiatives with my experience in the international scenario, I brought it in the need of our for an entrepreneurship more than revenue or the financial model. With an education I got from India, I'm giving back to the country with the need of our situation. And I've been very fortunate enough to do some kind of a service back to my country, though I left the country around 20, 30 years back. I take this as a kind of an opportunity to give back to country, and also thank the Golden Aim Awards team in recognizing and reaching out to me and enabling this award. And thank you very much. Once again, meeting all your great doctors here, and pleasure to meet you all. And thank you once again.
Thank you so much, Doctor. Our next award category is Women Super Achiever Award, Gynecology. And the award goes to Dr. Diana Mihai, Obstetrician and Gynecologist, Ladies Excellence Clinic. Congratulations, Doctor. Can we have a few words from you, ma'am?
I am Dr. Diana Mihai from Bucharest, Romania. I am the president and founding member of the Romanian Society of Aesthetic Gynecology, and as well vice president of the International Association of Stem Cell and Regenerative Medicine. It is my great honor and pleasure to be awarded for this prize. Thank you very much for excellence and leadership in healthcare. And I encourage all women that are interested not to be afraid to follow their dream and do whatever makes them happy. So with passion, you can achieve many things, and especially in medicine, like other fields, of course, without passion, you cannot do amazing things. So congratulations for everyone awarded today. And thank you again for this award from you.
Thank you so much, ma'am. Our next award category is Most Trusted Hair Transplant Expert Pune, and the award goes to Dr. Narendra G. Patwardhan, Consultant Dermatologist, Hair Transplant and Laser Specialist, Maharashtra, Medical Foundations, Joshi Hospital, Pune. Congratulations, Doctor. Can we have a few words from you, sir?
Thank you very much to the organizers. I am Dr. Narendra Patwardhan from Pune, India. I have been in the field of dermatology for more than 40 years. My passion in lasers, dermatosurgery, and hair transplant took me to Israel, wherein I learned all the techniques of lasers, various lasers, and afterwards the hair transplant surgery. I have been in the field of hair transplant surgery for more than 20 years, and I owe everything to my guru, Dr. Alex Ginsberg from Israel. He taught me all the techniques of hair transplantation, and I implemented those with him, with his help here in Pune, and developed a center. I have been doing hair transplant first with FUT and now with FUE. My advice to all my young colleagues is you must follow your passions. You must pursue your passions. Find out a proper teacher or guru. When I started, there were no such the online courses available. Now we have lots of senior teachers in India and abroad who can teach you hair transplantation. You become a member of the Association of Hair Restoration Surgeons of India, and you learn the new techniques. At the same time, you can become a member of Association of Senior Surgeons of India and learn the dermatological techniques. You master the techniques, prepare, make your own team, and pursue your passion of hair transplantation. Do it with absolute vigor, do it with all ethics, and you will certainly be a very successful hair transplant surgeon. I really thank the organizers of the Golden Aim Conference and Awards for recognizing my work in the field of hair transplantation. And I really thank the Almighty and thank everyone for choosing me for this. Thank you very much.
Thank you so much, Doctor. Our next award category is Most Trusted Laser Expert for Skin in Karur, and the award goes to Dr. K.V. Kavita, Chief Consultant Dermatologist, Skin Trust Hospital. Congratulations, ma'am. Can we get a few words from you, ma'am? Our next award category is Most Trusted Hair Transplant Surgeon in Kolkata, and the award goes to Dr. V.S. Rathod, Cosmetic Surgeon, Kaya Kalp Cosmetic and Laser Treatment Clinic. Congratulations, doctor. Can we have a few words from you?
Thank you. Thank you so much, Golden M Conference, for this prestigious award of the best hair transplant surgeon in Kolkata. As a doctor, my goal has always been to change life for better, and recognitions like this keep me inspired. For almost 20 years now, I have only worked, be it a hair transplant surgery, liposuction, cosmetic breast surgeries, or facial aesthetic surgeries. I have never stopped in fact. But today, as I receive this award from you, I look back at my journey as a cosmetic surgeon, I realize there's still a long way to go. There are still many more lives to change, many more stories to witness. I am director of Triathlon Cosmetic Clinic in Kolkata. I was faculty in Jharkhand Medical College and National Medical College as a head of the Department of Plastic Surgery. As an faculty, international faculty for Arabian Medical Institute, I give training for Botox fillers. Recently, before France, to visit France, Paris, Monaco. I do training for non-surgical facial rejuvenation with the help of Botox and fillers. I do regular training to the juniors to learn hair transplant surgery at my clinic. I teach them both SUT technique as well as thank you once again, the Golden Excellence Award. Thank you once again.
Thank you so much, doctor. Our next award category is Most Trusted Hair Transplant Expert in Chennai, and the award goes to Dr. M.M. Thirumalai, Hair Transplant Surgeon, Degraft Hair Transplant Center, Chennai, Medway Hospital. Congratulations, doctor.
Good morning. I am Dr. Vasan from Chennai. I am a hair transplant surgeon. I would like to thank the organizers and juries of Golden Name Awards for nominating and giving me award for Most Trusted Hair Transplant Surgeon. First of all, I would like to dedicate this award to my dad, without whom I would not have been in this field. Secondly, I would like to dedicate this award to all my staffs and colleagues who are supporting me till date for past 15 years. Thirdly, I would dedicate this award to all my patients and clients who are still trusting me what service I am doing for in this field. Thanks you once again, Golden Name Awards, for electing me as Most Trusted Hair Transplant Surgeon. Thank you.
Our next award category is Best Digital Health and Wellness Monitoring Application Award, and the award goes to Bell Health. Congratulations.
Hi, again, this is Dr. Rao Teki calling from New Jersey. Once again, I thank Global AIM Awards team in recognizing this application. Team, if you can give me a few minutes, I can share my presentation. Is that okay? As I was talking earlier, a few minutes back, we have seen that change in healthcare is happening. So this is where I was talking about the mobile application, that Bell Health application is helping the Indian community in the health and wellness monitoring. It is not necessarily for Indian community, but at least I started with Indian community because that's where the need of our existing. So the Bell Health application actually enables the true connectivity between the patient and the relatives and then the healthcare providers. So today, the healthcare industry is changing significantly. Ernst & Young report says that the true transformation requirement is coming up for the healthcare transformation. Long-awaited transformation is underway. With that said, that industry or the population is looking for better tools to connect with the patients and then the physicians, And also the shift in the healthcare is happening more into kind of a preventive care compared to a kind of a reactive care. That's where the digital networks and digital frameworks are coming up pretty well, as the other doctors have been talking about digitization in the healthcare. It is an extension to this application, actually, how this healthcare application is going to help this patient monitoring and remote enablement of the true connectivity, real-time connectivity with the patients as well as the physicians. So the healthcare application, this what we brought in is Well Health, can help in monitoring across the wellness scenario, but primarily I had taken it to 4 areas. This where actually we need a significant intervention in providing this healthcare application enablement and bringing the value across the value chain of a healthcare delivery. The primary component is maternal health, and then the pediatric healthcare, and also care continuum wellness monitoring. I'll walk you through in brief minutes, like how actually all these 4 buckets have been addressed to this mobile application. So I will pass this one and then moving on to Well Health application. So when you look at it, maternal health, I know there are a lot of learned doctors here, but from my view on the maternal health care is, this is the only condition in the entire healthcare where a diagnosis is been a happy news for any patient. When a woman comes to clinic and the woman is being diagnosed as she is pregnant, then they feel very happy. Not only the woman and the entire family feels happy. But with the current situation, that's what's happening in the environment. Population is going through so much of stress. These pregnancies are becoming kind of a stressful and also becoming kind of the precious pregnancies. Some of the reasons that you put in is lifestyle is one of the area. And second thing is work and job stress are continuously high in the Gen Y population. And the academic stress is also adding complexity to the pregnancy. And then simple factor is a daily commute is a significant problem within the maternal health scenario. So having realized this one, a continuous monitoring tool is required. So with this mobile application, people can actually measure their pregnancy and also diagnose the pregnancy once it's been diagnosed by the physicians. And they were able to monitor what need to be done at each trimester, right? Like pretty much they're being available in Google and all these places, because this is a kind of an AI ML application wherein we'll push the notifications or the information specifically fine-tuned for the patient population with the demographic scenario, like age of the population, stress levels, so many other factors have been put into kind of a maternal health. And that's where we are bringing this application into the wellness monitoring of the pregnant female. And now child health. As the child are becoming kind of more and more precious, and the continuity of managing the child healthcare is becoming kind of a significant problem, because of the parents are kind of loaded with the workload, lot of stress, and they're not able to focus much onto this kind of a child health. So we felt this application definitely helps in monitoring the child health. And also seen that, especially when you look at it, India is, while progressing in multiple factors, on the healthcare scenario, a couple of things are little concerning is the obesity is significantly increasing even in the young population. So also there is a kind of diabetes situation is also significantly increased in India in past few years. So how do we curtail this one? By monitoring the child health and a very early stage, or continuously monitor, because while you are at work, we're really not able to know what's happening to our children, right? So especially when the children are sick, the parents become more anxious. So this application helps in monitoring the child health on a continuous basis. It also gives the actual vaccination schedule, and reminders will be continuously pushed to the parents to, I would say, strictly follow the immunization schedule, so that they will not miss any immunization schedules or immunization processes within the child health monitoring. And the care continuum. As I was talking about, care continuum has become kind of a significant value proposition today, because most of the times then the doctors, when they see the patients, they will actually advise the patient goes home, and after a month, the patients are coming back telling that at least the doctor, the medication or the condition has not improved. And that's where the situation is coming up. Either the doctors are changing medication, or they are not been shifting the doctors, the patients are shifting the doctors. not knowing they have not followed what doctor has advised. So this is where we are bringing the care continuing application. So continuously monitor the vital signs or the advice they provided by the doctor is being followed by the patient in the last 1 month or between the periods of visits. So they will able to actually push a kind of information from the patients, how they actually done based on last parameters versus the upcoming parameters where the patient is coming up. So this is the application actually helps in continuous monitoring of the patients, though they are at a remote. So that will give an insight to the doctors how they have been following the instructions of the doctors, not only the medication, and also the other activities, say like in diabetes, at least 2 hours to walk or at least 30 minutes to do some kind of exercise. Those things have been how frequently followed can be monitored. Then they can have an informed conversation with the patients when they come for follow-up. And now finally the wellness monitoring, right? Like as I was talking about, the healthcare cost is significantly increasing. And also we are moving into kind of a proactive care compared to kind of a reactive care. As the Walden statement goes, kind of a health is wealth, it's a true sense of health is wealth today's scenario, because if health is not in a robust condition, we're not able to do anything. So this application is being designed to provide wellness monitoring application, process. One factor that we take in it is, while we talk about all the reactive care, when the wellness monitoring comes in, all the focus is in the within the primary big cities only. But wellness monitoring is also key important factor when we look at it, the remote villages and those areas. This application is easily enabled within the remote parts of the India, and that will give you continuous monitoring of the blood pressure and all those scenarios that we continuously monitor. This is the dashboard the application provides in a very user intuitive, and self-tracking of all the vital signs can be measured significantly within this application. And they can also share with their relatives. So say like we looked at the Indian demographics, roughly around 300 to 325 million population under the age of 35 are living in India. After that, 50%, like close to 150 million population is living away from the parents. As an Indian, we all know that we are always conscious about our parents' health. So that's where we keep talking to them. And then they say that parents will always say that in the constraint of, they don't want to give a stress to the kids. So they say that though they're not doing good, they continuously say that we're doing good. But with this application, we can actually, these children can actually measure or have an informed conversation with the parents, stating that you did not do good and you did not, blood sugar is not good today. Is there any issue kind of scenarios? When they have that kind of informed discussion with their parents, they will able to see obligated that my son or my children are following my health. I had to follow my regime and see that my son is happy or my daughter is happy kind of a scenario. That's what we are enabling through this mobile application. And I'll take a pause here. If any questions, I'm happy to answer. And once again, I thank Golden M Awards team for recognizing and then facilitating of this application as a kind of the need of our for Indian community. Thank you.
Thank you so much, Doctor. Our next award category is Iconic Healthcare Leader Award, Surgical Oncologist. And the award goes to Dr. Umang Mithal, Director Surgical Oncology, Meerut Cancer Hospital. Congratulations, Doctor. Can we have a few words from you, sir?
Thank you and good evening. Can you hear me?
Yes, Doctor.
Well, at the onset, let me thank Golden Lion Award to recognize some contributions that I have made. Cancer today, we know, is a big epidemic everywhere. In India, at this time, we have 27 lakh cases and 13 to 14 lakh new cases of cancer arise every year in India. That's the incidence in India. And we have almost 9 to 10 lakhs mortality every year, because most of our patients that we see in cancer come late. One of the primary things which is responsible for that is poverty. And I've been practicing oncology in NCR in Meerut. Meerut is a small semi-urban area near Delhi, which is my primary place of working since 1998. And the problem that I have seen in my practice is that patients are too poor to actually even go for any treatment. What I have tried in my 23, 24 years of practice is to make sure that each and every patient at least gets the right consultation. And I've been seeing every Wednesday, I see patients free of cost. Apart from that, what I have been trying to do is trying to get at least 50 to 60% discounts in the cost of medicines that is available for chemotherapy, and at least 70% discounts in the cost of PET scan. I mean, in my place, 27,000, but my patient gets it for 8,000 rupees, so on for medicines. And I think that is the most important thing today that we can do if we want to try to improve the survival and treatment of our cancer patients. For surgical part, I'm a surgical oncologist. I started my practice both in Meerut and Delhi, and I realized that the amount of charges that are there in metros are huge, and most of our patients, especially who are self-paying patients, cannot afford that. And I have tried to operate the same sort of cases, same sort of treatment at 25 to 30% cost of what it costs in the metro. And I am happy to say that people have recognized the fact that they get that treatment which is equivalent to the best in India. I've had patients from Tata Memorial, I'm basically an alumni of Tata Memorial Hospital, Bombay, and I've had patients who have come from there because they've been told that you belong to Meerut or this area, and you can get equally good treatment out here at a reasonable cost, because in Tata sometimes the waiting list is tremendous. So what is important, I feel, is that all of us need to look at this class of patients who actually are not able to get treated because they're either scared to consult us, and getting a free consultation is not something difficult. We just have to tell them that, okay, we are available for you. And I have actually had patients where radiation is required, and they're good friends in metros or all Indian institutes, and they actually go out of the way to help our poor patients get treated at free cost also. So as doctors, as cancer surgeons, as various other specialists, I think if we can have that sort of thing, that we are here to do a practice, we are there to help the patients. Money is going to come to you. I mean, if you don't run after money, money is still going to come to you. So I don't think that should be the things why we should be being a doctor. And apart from that, if we can just make sure that we try to give the best to the patient at the most reasonable cost, and try to have a tie-up with a lot of the government hospitals. I say 95% of my patients today in Meerut are getting some sort of treatment which is equivalent to almost the best. From the time when I came, the cancer treatment was non-existent, and I realized that people of cancer were not even coming to show me because they said that they're going to die. So I mean, this is something that I would just like to say, that today cancer is a pandemic and it is increasing. And India is in a worse scenario because our mortality is very high because of lack of awareness. And each and every one of us, irrespective of the specialty, should try to provide that awareness to the patient and tell them that cancer is very much curable. And we have very reasonable places available at each place where we are staying in India. And again, I would like to thank the Golden Name Awards to recognize some of my efforts. Thank you very much.
Thank you so much, Doctor. Our next awardee is Dr. Ritesh Tapkire, Deputy Director, Kachar Center Hospital and Research Center, Assam. Congratulations, Doctor. Our next awardee is Dr. Amit Chakraborty, Consultant Cancer Surgeon, Specialty Surgical Oncology. Congratulations, Doctor. Our next award category is Dynamic Healthcare Leader Award Pediatrics, and the award goes to Dr. G.S. Kumar, MBBS GS Hospital. Congratulations, Doctor. Can we have a few words from you, sir?
Good afternoon. Am I audible?
Yes, Doctor.
I thank the organizers for selecting me. It's a booster dose for rural practitioners. I've been doing my pediatrics practice for the past 38 years. It is really a boosting dose and an encouragement. We will continue to do the same to the upcoming generation. Thank you.
Thank you so much, Doctor. Our next awardee is Dr. M. Singaravedu, RK Hospital for Women and Children Private Limited. Congratulations, Doctor.
Good evening to all. At the outset, I thank the Golden Aim people for selecting me for this award. I have been in Tanjavur for the past 4 decades doing pediatric practice. It is also like a rural, but I have been in teaching line for the past 30 years as a postgraduate UG teacher and also doing rural service. I could see the paradigm shift in pediatrics over a period of 3 to 4 decades. Definitely, a lot of my students are following the ethics which I have been following for a quite long time. I'm happy and being honored, and I'm happy that our government and our association like Indian Academy of Pediatrics, IMA, all have recognized. Along with that, it is, as my friend Kumar was telling, it is like a booster dose. We got so much awards, but still people who are totally unknown to me selecting me and honoring me with this award is really gives some more energy for me to do good work for the community. Surely we will live up to our expectation to do something for the community where we are living and we are coming up. Thank you, sir. Thank you for giving me this award.
Thank you so much, Doctor. Our next award category is Women Healthcare Leader Award, Surgical Oncologist. And the award goes to Dr. Tapti Sen, Head of the Department Breast Diseases, AMRI Hospitals, Mukundapur. Congratulations, ma'am. Our next award category is Iconic Healthcare Leader Award, Medical Oncologist. And the award goes to Dr. Ganpati Bhatt M, Senior Consultant Medical Oncologist, Jaslok Hospital and Research Center. Congratulations, Doctor.
Thank you for this award, and I humbly accept this award. And I have been graduated from Karnataka University Dharwad in 1993 and did my post-graduation in medicine and Jaslok Hospital and trained in medical oncology and bone marrow transplant in Kuwait Cancer Center, and I've been trained in various European Society of Hematology and International Center for Advanced Studies in Germany, and I've been practicing medical oncology and bone marrow transplant for the last 20 years. And coming from rural place and to the practicing in city, seeing the various facets of the cancer burden, technologies, futures. So it is a journey which has taught us one thing that I can say, that we have to have the passion to do this service, and we should give back to the society back, and we should teach our younger generation, train them to this novel treatments and make. And another thing that as Dr. Umang told the surgical oncologist, that awareness of the cancer burden, the modality of the treatment, how to give the best treatment to all the section of the society in countries like us is very important. So I believe that such awards always encourages us to give the society back the service. And I once again thank the organizers and all other colleagues who have attended for this award and having trust on me. And I hope the future will continue with such encouragement and such services and to the society as well. Thank you.
Thank you so much, Doctor.
Yeah.
Our next award category is Women Healthcare Leader Award, Medical Oncologist. And the award goes to
Thank you so much.
Dr. Shah,
Yeah,
Senior
can you hear me?
Consultant Medical Oncologist and Hematologist, Gujarat Cancer and Research Institute.
Thank you so much. I extend my heartfelt thanks to Golden Aim and the organizers for giving us this opportunity and recognizing our work. So as a breast cancer surgeon, what I feel is this is one area where the women, they actually take a back seat because they're not bothered about their own health. And we don't find many screening opportunities for the women because this is all a self-initiative. There's nothing like a program which is run by the government. And I would rather urge the concerned officials that they should have a government undertaking of a program for breast cancer screening. But till then, until we have a robust thing to raise the awareness amongst the women of India, it's the onus goes to the breast cancer specialist. They have to relay this message, send this message across to the women to be aware of their health, to do a screening, a regular screening for themselves. But the understanding of the screening also is very important. Not every woman, what is the right age to start with the screening? What is the right age to end? How frequent? So we don't have a definite guidelines for that. But if you consider the US task force guidelines, you consider the NICE guidelines of UK or other Western world, they are doing a screening starting at the age of 45 or 50, and they're doing it every 2 to 3 years for an average risk woman. This is a little different from what we do for a high risk woman. But yes, for every Indian woman, I would say starting age of 40 to 45 and doing it once in a year or once in 2 years is mandatory. For a clinician, I would say you need to be a very, very strong pillar for the patients. So you should be a strong pillar in terms of, science and knowledge. You have to be at the top. You have to know, you have to understand and practice the standard. You have to practice what international guidelines recommend so that you can offer the best treatment to your patients. The guidelines keep changing. You have to be updated all the time. So you have to be a very, very strong platform for all the patients, all people, all women, so that you can diagnose even the smallest of the cancer anytime. You can diagnose the lesion before it goes and it becomes a big cancer. Diagnosis is very, very important. You cannot afford to miss it anytime. We have different tools. We should use all the standard and the recent, tools for diagnosis, including the DBT. We are talking of digital mammograms. We're talking of vacuum-assisted biopsies. We're talking of even all the innovative methods that we use, and for oncoplasty as well, using ICGs for reconstructions, so that you don't default anywhere, so that your patient doesn't suffer at all. You have everything done, set in one go. So your patient is also satisfied because he cannot be coming running all the time. So what I need to say, to have a perfect tool, to have a perfect understanding, information, knowledge, everything is important. And of course, the cost. So offering the patients the treatment with the best possible cost, subsidized cost is very important. They cannot afford to lose their money on the treatment, especially the cancer treatment, which is very, very costly. That is all that I would like to say. Thank you so very much for the opportunity.
Thank you so much, Doctor.
Our next award category is Women Healthcare Leader Award, Medical Oncologist. And the award goes to Dr. Kajal Shah, Senior Consultant Medical Oncologist and Hematologist, Gujarat Cancer and Research Institute, Ahmedabad. Congratulations, Doctor.
Good evening, everyone. I am really thankful to the Golden Aim Award team for recognizing and giving us award. This award is a symbol of blessing for our journey. So I am practicing as an assistant professor in medical oncology department since 11 years. I did medical oncology course from Tata Hospital, Bombay. Then I joined Corporate Hospital, Selby. Then I shifted to GCRI, Gujarat and Cancer Research. In my I have experience in treating and preventing.
Our next award category is Iconic Healthcare Leader Award, Interventional Radiologist. And the award goes to Dr. Ramurthy Susarla, Dean and Senior Professor, Interventional Radiology, Nizam's Institute of Medical Sciences, Hyderabad. Congratulations, Doctor. Can we have a few words from you, sir?
Yeah, very good evening. At this juncture, I would like to thank the GCC Conclave and the organizing team of Golden Aim Conference and Awards for giving me this award. It means a lot to me personally. It gives me immense pleasure to note that my humble contributions are recognized by the society that we live in and work for. God's been kind to me, giving this wonderful opportunity of serving the society by way of delivering healthcare through my specialty of interventional radiology and also medical education by virtue of being a medical teacher. The specialty of interventional radiology, as you know, is a minimally invasive image-guided therapy, which is rendered through a very small hole. You can also term it as the pinhole surgery. It can render treatment to the blood vessels of the body. Various disorders and diseases of the blood vessels can be treated by this modality from head to toe, as well as the other organ systems of the body. Well, I had the opportunity and the pleasure of starting the very first dedicated interventional radiology facility in this very institution, which is a public institution, university established under the state of Telangana, and to serve the people of Telangana, Andhra Pradesh, and the neighboring states over the last slightly over 30 years. I once again express my thanks to the organizers for recognizing my services to the society and dedicate this award to my beloved parents, my wife, and my daughter, who have stood behind me in my endeavors. Thank you so much to the organizers for recognizing my contributions. Thank you once again.
Thank you so much, Doctor. Our next awardee is Dr. Tejas P. Dharia, Vascular Interventional Radiologist, Mumbai Endovascular Center. Congratulations, Doctor. Our next award category is Iconic Healthcare Leader Award Radiologist, and the award is to Dr. Sukrit Mittal, Director and Consultant Radiologist, Mittal Diagnostics and Research Center. Congratulations, Doctor. Our next awardee is Dr. Ipsit Menon, Consultant Radiologist, University Hospital of Leicester, NHS Trust, United Kingdom. Congratulations, Doctor. Our next awardee is Dr. Reshmi CP, Senior Consultant Radiologist, Anantapuri Hospital and Research Institute. Congratulations, ma'am. Our next awardee is Dr. Arpita Singh, MBBS and MD Radiology, Vision Life Diagnostic Center, Varanasi, UP. Congratulations, ma'am. Can we have a few words from you, ma'am?
Good evening. Thank you so much. It is really a great honor for me to receive this special award. And I want to thank all of you, your team, for bestowing me with this award and appreciation. I've been practicing radiology in Varanasi. I was at Banaras Hindu University as consultant radiologist, and now since last 4 years, I'm running my own diagnostic center and a consultant radiologist here. And as a doctor, I always in doing a genuine and ethical practice. And I think award will definitely boost the confidence of other radiologists and other doctors who believe in similar principles of ethical practice. This recognition is definitely a significant milestone in my professional life, and it will definitely motivate me further to work with the highest level of zeal and dedication. And truly, I was completely unaware that I considered for this. So therefore, it came as a delightful surprise for me, definitely. And so in the end, without taking much time, I would like to thank all the jury members of the Gold Award for considering me for this. Thank you. Thank you.
Thank you so much, Doctor. Our next awardee is Dr. Reshmi CP, Senior Consultant Radiologist, Anantapuri Hospital and Research Center. Congratulations, Doctor. Can we have a few words from you, ma'am?
Am I audible?
Yes, ma'am.
Yeah, thank you so much. Actually, this award came as a surprise for me. So I thank all the organizers of this Golden Awards for selecting me for this award. And I'm very happy and proud that I'm sharing this among different eminent personalities in different fields. Thank you so much. Thank you once again.
Thank you so much, ma'am. Our next awardee is Professor Dr. Colonel Sudhir Sachar, Professor Radio Diagnosis, ex-Indian Army, AFNC Professor of Radiology. Congratulations, Doctor. Our next award category is Women Health Leader Award, Pediatric, and the award goes to Dr. Sumita Saha, Consultant Neonatologist and Pediatrician, Otis Hospital. Congratulations, ma'am. Our next award category is Dynamic Healthcare Leader Award Pediatric, and the award goes to Dr. Rajiv Kumar Mittal, Pediatrician, Sanjeevni Medical Center, Meerut. Congratulations, Doctor. Can we have few words from you, sir?
Good evening, everybody. I'm Dr. Rajiv Mittal. It's great pleasure to be here on this platform and receiving the award from Golden Lion Award. And I'm very thankful for the organization and the jury. I'm doing practice of pediatrics and neonatology since 25 years, and I am especially working for the respiratory distress syndrome in neonates, and especially preterm neonates. It is especially very threatening condition for the newborns, and the conventional management is very costly. It's around 10,000 per day, or even in a 25,000 per day, including ventilator and surfactant therapy. I am trying to cut down the expenses and reduces the things and try to make it approachable to every poor patient also by very economic medicines. And especially I'm thankful for again the jury and the organization to recognize my work. Thanks a lot.
Thank you so much, Doctor. Our next awardee is Dr. Neeraj Sharma, Pediatrician and Neonatologist, Dr. Neeraj Sharma Clinic. Congratulations, Doctor. Can we have few words from you, sir?
Hello.
Yes, Doctor.
Hello.
Yes, Doctor.
Am I audible?
Yes, Doctor.
Am I audible to you?
Yes, Doctor.
Myself, Dr. Neeraj Sharma from Meerut, UP. I am thankful to you and your team to recognize me and my work. And also, I have a special interest in neonatal intensive care and respiratory distress in the newborn, and also the methodology of newborn. I wanted to do the work in a reasonable price. Whatever the work is done in metro centers and metro hospitals of the India, that I want to do all these work in the reasonable cost and reasonable price in the city like Meerut, UP. And I also help the poor and rural population for this. I again thanks Golden Aim Award team for the same to recognize me and my work. Thank you.
Thank you so much, Doctor. Our next awardee is Dr. Joshi Anand Kirkata, Pediatrician, the Mission Hospital, Durgapur. Congratulations, Doctor. Can we have few words from you, sir?
Good evening, everybody. It's my real honor to be awarded this award, Golden Aim Awards, out of nowhere. It is God's gift because people like you come to realize all the work which small pediatricians are doing in the rural and the sub-rural network. I'm working in a small hospital, and I especially am doing a lot of work with the NGO who looking after the orphan and the children and the street children because I believe in prevention is better than cure. Giving a small chance to these small children will help them to grow up someday into a good person of society. And it's a great honor and joy to get this, especially looking at the whole panel of doctors who are so renowned and famous. It feels very good to be a part of this big gala team. Thank you once again to Golden Aim and all the people in this organization. Thanks once again.
Thank you so much, Doctor. Our next award category is Dynamic Healthcare Award, Intensivist Critical Care, and the award goes to Dr. Sunil Karan, Head of Department and Chairman of Critical Care Services, Manipal Health Enterprises Private Limited. Congratulations, Doctor. Can we have a few words from you, sir?
The outset, I'd like to thank the Golden Aim Awards team for recognizing my work. As many doctors in this esteemed forum told that it was a real surprise, it was a surprise for me as well. When out of the blue, I got this message and a mail saying that I was selected for the award. I thank you for recognizing my work. As you all know, critical care is a relatively new specialty, probably grown up in the last 2 to 3 decades. I was lucky to be one of the first national board candidates from the country. I got my Australian fellowship and returned back, I think, in 2010, and ever since I've been working in Bangalore. My special interests are trauma, poisoning, and obstetric critical care. Because these are niche areas in critical care where I believe we can make a difference for the younger people, and most importantly, these are diseases which afflict primarily the middle class or lower middle class people. So I've been working in critical care for the last 10 years as a teacher and also as an examiner and a lot of other things. Research is one of my areas of interest as well. I am just too happy and honored to be part of this award ceremony. Thank you again for recognizing my work.
Thank you so much, Doctor. Our next award category is Dynamic Healthcare Leader Award, Pulmonary Medicine. And the award goes to Professor Dr. Manoranjan Patnaik, Professor, Department of Pulmonary Medicine, SCB Medical College and Hospital, Odisha. Congratulations, Doctor. In my life, I have always learned to end the event with a positive thought. No matter how hard it was tomorrow, is a fresh opportunity to make it better. At the end, every step must affect forever. Maybe I had to inspire some more stars next year. With this now, we come to an end of this award ceremony and today's webinar. May I request Dr. Fadil Khan to do closing remarks. Over to you, ma'am.
Thank you, Professor Sayed. Thank you to all the esteemed participants. It has been an honor to have you all present in our event. Your participation ensures the success of the event. Once again, I thank you everyone for all the kind support. I also like to thank Professor Sayed for being a wonderful host for the evening. I also like to thank two esteemed speakers, Dr. Ramesh Bilimagga, Dr. Balakrishna Shetty, and Dr. Ramarjit Lahiri for taking time from their busy schedule to be the guest speaker at our seminar. Your presence and your wise word help magnify our cause in the best possible way. Our seminar is a huge success, all thanks to your enlightening word that inspires so many people out there. I also like to thank you on behalf of other guests who have been thrilled to have you as a company and exchange few words with you. I cannot thank you enough for gracing our seminar, all your spirit and making everyone feel at home. I'm looking forward for our next interaction soon. Wishing you all for best for the future. I also like to thank our gold partner, Dinergic Business Solution, and a presenting partner, Pharma Global Management CEO and co-founder, Mr. Azharuddin Faruqi, for all the support and the opportunity to work with him. Last but not the least, to all the participants and the award winner, wishing you all a many congratulations for the award. Hope to invite you soon again. Thank you, everyone. Stay safe, stay healthy.